Anyway, I thank you all for inviting me. I'm not really sure why I was selected to be on this panel, except that I think people find my ideas somewhat mildly entertaining at times. And I think I've decided I'm starting a whole new political party, or it's a DSM-5 diagnosis, and I call it skeptical pragmatists. And I'll just give you a little bit of my flight of ideas. I was very much involved in some of the turbulence of healthcare reform over many years, not just this administration, but and advised both sides of the aisle. And frankly, I've always said I don't really care where the ideas come from. I'm all about solutions, and I don't care which side of the aisle they come from. The best description I've ever heard of our current healthcare system is a Gordian knot designed by Rube Goldberg. And I think that's a perfect description. And I frankly have a hard time believing that more regulation and more structure and more bureaucracy and more oversight is going to actually improve that picture. I did think we need to ask ourselves the questions. Should we trust a payer system that's effectively an unsustainable Ponzi scheme? You know, really. Should we trust hospitals? And not that I don't enjoy working with the hospitals and enjoy my hospital colleagues, but, you know, hospitals have their bottom line motive and have proven themselves in very recent past to be fair weather friends. And, you know, I think that we have to have common sense as we approach this equation and whether we're going to participate with accountable care organizations as family physicians. In terms of how our hospitals can work with family doctors, a couple basic things, and I will just touch on. And this is true for my insurance colleagues as well. It is high time, it is way past time for primary care doctors' value in the healthcare system to be respected. We are tremendously undervalued, and I can pull out my own EOBs from my family's medical care in the past year and show you the 10-minute ER visit that got paid $880 for something I would get maybe $65 in my family practice clinic for doing that exact same level of care. That, to me, is unconscionable. The guy who got paid exactly $540 to put a dose of propofol in my arm for endoscopy. That is worth how many Medicare physicals, how much of the family physician's time? That is unconscionable, and that needs to be corrected. I would encourage hospitals to stand up and not bite the hand that feeds you. When hospitals perform free immunizations in all the school clinics to my insured population as well as the uninsured or the needy population, when they are performing free bone density screenings in the community and free cholesterol and blood pressure screenings and cardiovascular risk appraisals on my insured patients, they are undermining my business. And as family physicians, we need to speak up about that. We also need hospitals and insurance plans to encourage a true free market where patients pay directly for non-exigent services, non-emergent services. Direct primary care models, whether it be the MinuteMed clinics or the models run by nurse practitioners to the very high-end concierge models, are a free market approach that have proven to be highly economically effective, provide high quality patient care, improve hospitalization rates, improve provision of preventive care at a lower cost. They're true patient-centered models, and the effect would be like deregulating Bell Telephone. We have the opportunity to all of a sudden have direct primary care at all price points, which insurance, if they're creative, and hospitals, if they're creative, could help subsidize or support in some way. And I think we need to look at that. Get us out from under the the insurance middleman, because primary care does not belong there. It's not cost effective for us to work to spend 8 to 10% of our revenue to collect what we earned. Also, for hospitals, help us take advantage of economies of scale that we can't have. I mean, many people are predicting the demise of small independent practices, and I think that would be a shame. I have worked for many years. I worked for Cigna. I worked in academic medicine at Mayo. I worked in the United States Air Force, biggest HMO in the country. I have been in big institutional care, and there are a lot of advantages to that small independent practice. It may not be as efficient, it may not be as easy to control, but it is a lot more nimble and a lot more patient responsive. As I said before, don't lock us or our patients into a single hospital. I think that would be a huge mistake, and it will fail, I think, ultimately. And then provide an exit strategy, and this is for primary care docs. Provide an exit strategy for if this doesn't work out, for us to escape without, being shredded and dumping our assets for pennies on the dollar. And then again, think out of the box with these accountable care organizations. There are many neat models for co-ops and things where hospitals and provider groups are working together and contracting directly with employers. I have spoken to many employers who are looking for ways to reduce that double-digit increase in their insurance costs, and they're wanting to contract for primary care and services outside of their high deductible insurance. So those are just some of my thoughts, and we'll move along with the program so we can get to the questions. Thank you.